Greetings, and I'm back with Home Health Aide Chronicles Part 2. And what I'm going to talk about is I'm going to talk about home health aid versus long-term care aid. Which one is better? You be the decision maker on that. Number one, let's talk about long-term care. I was a long-term care aide since 1995. And the thing about long-term care, I'm going to tell you some of let me just tell you a little bit about it. I was going to say pluses and cons, but I really don't know any pluses and cons. Number one thing about being a long-term care aide, most of the times you don't get an opportunity to work in the hospital. You most of the time end up working in a nursing home. And let me tell you, it takes some strong, compassionate love for people to be in a nursing home, to be a long-term care aide in a nursing home. You really have to have the compassion to do this type of work. And it's not a job that you can do for money. You have to have the love of people. You have to have the servant's heart again. But the plus and cons about it, the pluses are you can make as much money as you want to make, but you might be working by yourself and you might be working hard. There is always available shifts in a nursing home. Now, you may find yourself working with some people that don't have the same work ethic as you do. You may find some people that are lazy. You may find some nurses that are lazy and will not help you. Generally speaking, that's what you get a lot of times in long-term care aid. But I have worked with some long-term care aides that have been very good and have done very good work. It's just that they can only do the best that they could do for the staff that they have. Now let's go back to home health aid. Home health aid is much better because you're going to always have that one-on-one. And the families are always going to be appreciative of you coming in to help them out. And they're going to help you. Sometimes, just like I said, you must be very trustworthy in order to go into somebody's house and provide that kind of care. And so to me, I was always a better fit for home health versus long-term care. I've done both. I've done medication aid, and it always has been that I was a better fit for home health aid. So, to me, the home health aid is a better advantage. It's a better title. It's a better working environment. It's better pay. I have never made bad money working as a home health aide. That is why, one of the reasons why I never pursued and went on to be an LPN, because I didn't make bad money as in home health aid. Like I said, I always could do a good job working as a home health aide versus as working as a long-term care aide. When I worked as a long-term care aide, I always felt like I did not never have enough time to do the things that I need to do for my residents. But I have plenty of time to do the things that I need to do and give companionship along the way as being a home health aide. So, to me, home health is better than long-term care aide by far. It's just the downside about home health. If you work on the private duty side, you 9 times out of 10 you work by the assignment. And sometimes assignments end because the people pass, and it might take you a little while to gain another assignment, but it's always somebody in need of your services. And that's when, like I say, the flexibility of you being able to go to school. If you have another business, like as well as me, as I'm an entrepreneur, I always had that flexibility. If all I wanted to do is work weekends, I always had that flexibility. I've been away from home health doing another job. I was working as a CNA, as an activity coordinator, and I worked that job for 14 months. And I came back now, and I'm a home health aide again. So it's always a great pickup job being a home health aide. There is always someone needing home care. assistance in their home. There's always someone needing. Even if you work as a PCA, which you don't make as much money working as a PCA versus working as a home health aide. But, if you get enough PCA clients, depending on what company you work for, they will pay you mileage. And not all companies pay you mileage. So you have to do your research and find out what benefits the home health companies offer you, because some of them got some good benefits. Like I said, the company I work has all three entities, and so it's been a blessing for me. So like I said, I have never made bad money as a home health aide. I have always enjoyed every one of my clients that I have gotten in home health. I can't say as much in long-term care. So that's all I have to say. You be the judge. And I'm out for Home Health Chronicles Part 2.